Okay, so I want to do a video tutorial on how to use, assess, and operate some of the features of our newest mannequin. This mannequin here we just got at end of 2016. It's made by the company Gamard, who is we have other products from Gamard as well. Her name is Susie. That's the brand of mannequin that she is. That's how we identify her. But during your simulation, she'll be whatever her ID bracelet is. She can be made to be male or female. The bedside monitoring for the mannequin for your patient, I want to talk about a little bit. If you are in beginning blocks and you're looking at this video for the first time, say you're in block 1 or block 2, you wouldn't need to worry about these features as much as if you're in blocks 3 or 4. So the bedside monitor in green has the patient's bedside EKG. It has the heart rate, that's in green. The red is the arterial blood pressure and the manual blood pressure. The blue is for respiratory. This gives you your respiratory rate. The yellow is the end tidal CO2. And then down here in pink is the SpO2. You would need to place the SpO2 on the patient in order to get accurate readings. If you are in a scenario where you need to retrieve a 12-lead EKG or ECG from your patient, you can do that on this monitor as well. The monitor is mobile, so it can be pushed back against the wall. It can be moved out. You can turn it however you need to. It's also touch screen. So up here on the top right corner, there's a green heart, and then next to it there's an M. The M stands for monitor. So if you touch that, a pop-down menu happens. It's the third one down. It says lead ECG 12. And if you click on that, the 12-lead ECG will pull across the screen. Now we try to teach you guys sometime during the program, whether it's in clinical or during a lab day, we do try to teach you a little bit about how to place proper placement for 12-lead ECGs. We don't do that on the mannequins because the sticky tape will wear on their skin, so we don't do it for that. So this is how you retrieve a 12-lead during this scenario. Now, if you have already done a manual blood pressure, which I'm going to show you how to do, you can refresh the patient's monitor to show you a current blood pressure. So here where it says NIBP, that stands for non-invasive blood pressure, if you touch on that rectangular box, another pop-down menu will happen. The very first one says STAT, so if you click on that, it will recycle the patient's blood pressure and you'll get an accurate reading. From where I sit as your facilitator, I can make changes to all these numbers and you can see them live as it's happening. The blood pressure I can make changes to, but unless you recheck it on the arm or refresh it on the screen, you will not be able to see the data there. Okay, some features about this high fidelity mannequin. Susie does have pupillary response, so make sure you're bringing your pen light to clinic or to sim days. It's a computer sensor, so when you go to flash the pen light and you're not getting a response, you may need to move your light just a little bit to get that response. Her nares, one nair is skin toned, one has a pink color. The pink color is if you need to do an NG tube or a nasal trumpet or something like that. She does have teeth, oral mucosa, all of that good stuff. She also has carotid pulses. We are also able to place a trach if we need to for this patient. She has carotid, brachial, radial, femoral, popliteal, and pedal pulses. All of her pulses are very easy and they're obvious where her pulses are. She has lung sounds, heart sounds, bowel sounds. She does have her pulses, and she has a blood pressure and pupillary response. When you're assessing mannequins during simulation, you're treating them like real patients. So you want to know cap refill, you would actually hold your patient's hand, and you would tell them, okay, I want to assess for your capillary refill. I'm going to pinch the ends of your fingers. You'll actually pinch it, and your patient will tell you, my capillary refill is 3 seconds or less than 3 seconds. So that's how we do that. Same with the temperature of the skin. You're going to walk up to your patient and say, I'm just assessing the temperature of your skin as you're touching lightly on them, and the patient will tell you what their temperature is. For the blood pressure, I want to talk about that because this seems to be a difficult one for a lot of students. The blood pressure, you first have to assess where the patient's brachial pulse is. And on the mannequin, the brachial pulse is really high up into the patient's armpit. So in order to do that, you want to make sure first you have for her, you can use any blood pressure cuff. I usually will have one in the bed or close to the patient. You want to identify where the artery marking is, and you want to have it along with that brachial. So let me demonstrate that. And these blood pressure cuffs need to go kind of high up on the arm. So her brachial artery is way up here. And so this is how I would apply the blood pressure cuff for her. In order to get a good blood pressure reading, if you were to do it once and you have to redo it, you actually have to release the blood pressure cuff and let the arm kind of rest and reset or recalibrate in order to get accurate readings. So when I do go to do the blood pressure, I want to make sure that my stethoscope is on the top part of the arm. So where the arm bends, I need to be above. And I should be putting my stethoscope close to where I expect that brachial artery to be. You cannot do a two-step blood pressure on the mannequins. They don't work. So that's how you obtain a blood pressure on this particular mannequin. Some other features that I wanted to show you for vowel sounds. I'll give her some privacy. Her abdomen here, I don't know if you can see this on the video, but if I push on her abdomen, it's hollow. And you can kind of see the plastic as I push on it. So if you lay your stethoscope where you would around where you expect the umbilicus to be, you're just going to hear amplified motor. So you actually have to move your stethoscope closer to where you would expect her hips to be in order to hear vowel sounds. Another thing for her that I think is an interesting feature is her lung sounds. You can hear lung sounds in the uppers. You can hear them on her sides, but she's pretty easy to move. If you needed to move her forward to listen to her lung sounds in the back, you're not going to hear crackles on a patient in the upper lobes. So you need to make sure that you assess your mannequin like you would a patient in the hospital setting. She also does have breaths that are very lifelike. It does help to know for the apical pulse, a lot of her mannequin tissue skin is kind of firm, and then the breast tissue is kind of soft. So when you go to listen to the apical pulse, if you actually lay your stethoscope on the patient's skin, and you actually lay it, I don't know if you can tell on the camera, but you're actually going to lay it on the breast tissue, that's the best. Another thing that I wanted to touch on for this video is her legs. I'm not sure how well you're able to see, but her foot here has a sore on it. And that came pre-made with the mannequin, and then she also has sores on the tips of her toes. So she always has these regardless which patient she is. So if you're doing your assessment and you see that, I should tell you before the scenario starts, but there's only like one patient scenario where we actually use that in the scenario, and you'll know based on your patient report that your patient has a wound. As far as anything else about the mannequin, just treat them very carefully. They're expensive, they are high fidelity, and they are computers. So you have to kind of move beyond that mindset of, well, I can't hear anything but the motor. Just move your stethoscope a few inches or even a few centimeters to the place where you expect to hear something, and you'll eventually hear it. There is speakers throughout the mannequin, so it's not a perfect setting, but it's the best we got for Susie. So that's your orientation on Susie.